So today is the final stage, action stage. So we were seeing four stages, right? Rapport, investigation, and which one? Planning. And the final stage is action stage. Okay. So in the action stage, the client has finished planning. So already our planning is over, right? Goal setting, smart goals, everything is over. And now is actually starting the exercise program. So it is the final stage, action stage. So rapport is over, investigation is over, exercise planning is also over. Now actually starting the exercise program. This is action stage. The trainer's role is to guide, supervise, motivate, and support the client so they can follow the program successfully during this stage. So this is action stage. So what are all the components of action stage? For example, last what we saw, investigation stage. In investigation stage, there are a few components where the rate important are like active listening, motivational interviewing and all. So let's see action stage. So the most important is self-monitoring approaches. So self-monitoring is very important, right? So when you're working out in the gym, you should always monitor your workout programs and your diet and your behaviors. So self-monitoring means it's not just about making a record of your workouts, like how many sets I did, how many exercises I did. So that also important. And also it's about your behavior. Okay. So maybe it's about your sleep also. So are you taking enough sleep? Are you sleeping like 7 hours? So just, today the most of the studies says that if you are working means you need to sleep 7, 8 hours and all, right? So yeah, it's about monitoring your behavior. Okay. Self-monitoring means that the client keeps track of their own exercise or health behaviors. This can be done using mobile apps, fitness trackers, gym electronic systems, written logs or notes. You can just make notes on your diary or something, or you can use today a lot of apps are available, right? Mobile apps and all. So you can use any kind of what like these apps or any kind of electronic devices you can use, or you can just also use notes. These tools record things like what exercise was done, so what exercises you did, resistance, reps, sets in strength training, so that also important. And at the same time, intensity, and heart rate during cardio. Any other data the trainer or client wants to track. So you're just tracking your behavior. Okay, so that's what self monitoring. Why self monitoring is important? See, research shows that self monitoring is one of the most effective ways to support behavior change. See, for example, you're going to the gym, you're not tracking your workout, you don't know what you're eating. So, if you're not tracking anything, means you will be less motivated, right? For better motivation, you need to track. So when you track what are all the things you're eating, what are all the exercises you're doing, means you will get motivated. So you'll understand what are all the things you're doing wrong. So where you need to improve. So you'll get some idea, right? So that self monitoring is very important. It helps people stick to their exercise plan and even improve their eating habits. Okay. Self monitoring helps in two ways. What are all the two ways? One is increases client self awareness. So, this is the important thing. So, when you're monitoring your behavior, so it increases your self awareness, right? So, you'll get to know that, oh, okay, the last 1 week I didn't do any proper diet and all. So, at least now from now onwards, I should start. Last week I missed 2 to 3 days of exercises, but this week it shouldn't happen. So, it creates awareness, so increases client self-awareness, what they are doing well, what they are not doing regularly. Okay, so positive and negatives, what they are improving. It acts like a mirror, giving them an honest picture of their behavior. So That is, that's why what self-monitoring is important. And the second is, yeah, this is the same thing on example. People often don't realize how much they move, eat, or sit. When they track their behavior, they see the truth clearly, which helps them make better choices. You'll get a clear idea what you're doing wrong and all, right? Example: a client thinks they walk a lot, but step tracking shows only 3,000 steps a day. So if you ask your client that you should increase your physical activities and all, means your client would say that yeah, I am doing only morning also I go to bring groceries, vegetables, and the evening also I go for some walk, and also I'm physically active. But when you ask him to track his steps by using mobile apps or smartwatches and all, so he will realize that, oh, okay, the trainer was saying me to do 10,000 steps, but I am doing only 5 to 6,000 steps. So he will realize. So it increases awareness. This awareness encourages them to increase activity, so that he will realize that, oh, okay, so I'm doing only, I'm not physically active, so I should increase my physical activity. So it increases awareness, improves communication between the trainer and the client. When the trainer reviews the client's workout records, it becomes easier to discuss. So it is for you, it will be easy to work with your clients. So when they track their behavior and all, so what is working, what is not working, what needs to change. This leads to more meaningful, productive conversations and better coaching. So if you are training a client, he is not monitoring anything, means it's very difficult to guide him, right? In case if he's monitoring his food habits, his workouts, his overall his lifestyle, means it is very easy for you to guide them, easy for you to motivate them. So that's why. So it improves communication between the trainer and the client. Means the quality of the communication improves. So that's what they're saying. This leads to more meaningful, productive conversations and better coaching. So you will have a clear idea what are all the strategies I should use and all. So if your client is not doing anything, means you will be blank, right? So you don't get any proper idea. So what are all the things? How can I teach him and all? So that's what they're saying. So this leads to more meaningful, productive conversations and better coaching. So self-monitoring is very important in the action stage. Effective teaching techniques. What trainers commonly teach? Correct lifting techniques for strength training. So these are all the things you do regularly in the gym, right? So correcting their lifting techniques, and also you teach how to use the gym machines and flexibility exercises. So you also provide them some stretchings and all sports drills, some sports related drills, maybe mobility, stability exercises related, or sports specific exercises, yoga postures, post rehabilitation exercises. So post rehabilitation exercises means, see, when you're a yes personal trainer, you're not supposed to do rehabilitation. So they are saying post rehabilitation. That means your client finished the rehabilitation. Now you're providing the exercises. Okay, don't get confused. In the exam, they may try to confuse these things. So you're not supposed to do rehabilitation things, but you can suggest exercises. You can train your clients who is just finished their rehabilitation. Okay, understand the difference. So post rehabilitation exercises. Trainers also teach clients in the cognitive domain. So what is cognitive domain? The cognitive domain refers to learning through knowledge and understanding. So cognitive domain means mentally you're learning through knowledge and understanding. For example, if I tell you that what are all the health benefits you get, and what are all the health issues you'll face if you're not doing any exercises, and if I provide you some articles about diabetes or exercises related, so you will learn something, right? So that is cognitive domain or cognitive learning. So learning through knowledge and understanding. Okay, not doing exercises, just mentally you're learning. That is cognitive domain. Okay, trainers also teach clients in the cognitive domain, meaning they explain how health problems affect the body. So you can explain that. So if you get diabetes, what are all the issues you are going to face? If you are getting some cardiovascular disease, what are all the issues you are going to face? You are guiding them. So how exercise affects physiology? So physiology means we are going to see physiology in the future. In simple terms, physiology means how your body responds to the stimulus. Or when you are exercising, your body responds, right? In simple basic example, for example, when you start exercises, your heart rate increases, your blood pressure increases. That is physiological responses. Okay, that is physiology. How your body responds to the stimulus, the stress you're providing to the body. So that is physiology. So you can explain how exercise affects physiology. So here I gave some random example, but how exercises affects physiology means it's a big topic. Uh, how to prevent injuries. To teach well, a trainer must understand how people learn. So overall, here the concept is as a trainer, you're not just teaching them how to use the gym machines or lifting techniques, not just yoga postures or exercises. Not just you're doing this. You're also teach clients in the cognitive domain. What is cognitive domain? These are all the things just now I have explained. So cognitive domain means you're explaining the benefits of health, or you're explaining the consequences. Consequences if your client is not physically active. So that are all the things that are all the things also you're going to teach your clients. So overall they are saying it's not just about teaching exercises. Okay. In this domain, trainers are not just showing exercises, they are teaching information that helps clients make smarter decisions about their health. That means they can make some logical decisions. So if your client is diabetic and if you educate them, so what is diabetic, so how to maintain diabetes and all, your client can make some logical decisions, right? So that's what they're saying. That helps clients make smarter decisions about their health. Okay. Next is stages of learning. Motor learning is usually explained in three stages. What is, let's first see what is motor learning. Motor learning is the process of acquiring and improving movement skills. In simple terms, you're improving the movement skills. So, for example, if you're a beginner, you can't do dumbbell chest press smoothly, right? If your client is beginner means he will do like these movements and all. He can't do proper movements because uh, because of lack of this motor learning. So when he improves his motor learning, the movements become smooth and effective. Okay. So motor learning is a process of acquiring and improving movement skills. So it also challenges your nervous system. So it improves the coordination between your nervous system and your muscles. So your nervous system will learn to exactly use the muscle groups. So which muscle groups I should use, which muscle groups are I should use to stabilize the joints and all. Okay. So that is motor learning. It is how the body and brain. So brain means that's what nervous system. It is how the body and brain work together to learn new physical actions like squatting, running, lifting weights, or balancing. So your brain will learn the things. Okay, so I should activate these muscle groups for this movement. So I should activate these muscle groups to stabilize those movements. So if you are a beginner, your brain doesn't know how to uh, activate the right muscle groups. So by practice, your nervous system or your brain will learn how to fire the right muscle groups. So that's what motor learning. Motor learning is not just physical. So motor learning means it involves the brain, nerves, and muscles learning to coordinate movements more efficiently. It's the coordination between your muscles and the brain, or it's a coordination between your the muscles and your nervous system. Okay. In the future, we are going to see what is nervous system, what are all the subcomponents of the nervous system, and all very in very detail. So right now, forget the nervous system, just think brain. Okay. Okay. Stages of learning. Motor learning is usually explained in three stages. The first one is cognitive stage, understanding stage. This is the beginner stage, or the you can consider this is the first stage of motor learning. Cognitive stage is the first stage of motor learning. Okay. So what happens here? Client is seeing or doing the skill for the first time. So your client is totally a beginner, right? So he's seeing or doing that one movement for the first time. For example, squat, bench press, or whatever. Okay. They are thinking hard about every movement. So movement looks awkward, slow, and uncoordinated. So that's what I said. When a beginner means they can't do that smooth movements, right? They will do a lot of mistakes and all. Brain activity is high because they are trying to figure it out. So here the brain activity is higher because the brain, not you, your brain is learning how to do these movements and all. So that is the cognitive stage, the beginner stage. Okay, here we have few examples of motor learning. Let's take a look. It's not very important from an exam perspective, but it is important from knowledge. For example, if you want to improve your knowledge, if you want to read some books and all, or if you want to do some advanced certifications and all, means these basics you should know, right? So that's examples of motor learning. Learning to ride a bicycle. At first, the person wobbles, loses balance, and overthinks every moment. In the beginning, it's very difficult, right, to ride a bicycle if you're in the first time if you're doing means. With the practice, balancing and pedaling becomes smooth and automatic. So after sometimes it becomes smooth and automatic, and it's not just about smooth and smooth. They use the term here automatic, right? It means you don't have to constantly think about this, right? For example, if you're a beginner, if you're driving a car, means in the beginning, you'll be very conscious. So by using the steering or how to I shift the gears and all. But after some practice, you don't have to think. You don't have to constantly think. So automatically you'll do the movements. You'll drive the car, right? So that's what they're saying. With the practice, balancing and pedaling becomes smooth and automatic. If you're riding a bicycle, means you don't have to constantly thinking that okay, I have to pedal like that, I have to balance like this and all. You can just enjoy the roads and you can aram say ride the bicycle. So that's what they're saying, automatic. One more example, learning a squat in the gym. A beginner may lean forward, lift heels, or struggle with depth. After practicing repeatedly, their form improves and the squat feels natural. Right? So you all experienced this, right? That's what. Okay. So in the cognitive stage, means in the beginner stage, your role is to tell, show, do. That means you should explain the skill, you should demonstrate it, means you should do it, and you should let the client to do it. So tell, show, do. In simple terms, tell means you will explain the movement. Next demonstrate. You will show it. You will perform it and you will show it, and you will allow the client to do it. So that is tell, show, do. Uh, okay. Now the second stage is associative stage. The first is cognitive stage, right? So cognitive means you can consider that it's the first stage of motor learning. Second is associative stage. You can consider this as the second stage of motor learning. Now the client understands the basics and is improving. So he is in the second stage. Now his movements are improving. He is not completely a beginner. So he is understanding the basics, not just understanding. He also learned basics. Okay. So he's in now. This is associative stage. Someone should Neerish mute. Okay. Okay. What happens here? Movements become smoother and more consistent. So compared to the cognitive stage, here your client is not struggling too much. So here the movement is slightly smoother and more consistent. The client starts correcting some mistakes on their own. So here the movements already became some smoother, and the clients focusing on correcting their mistakes. For example, keeping back flat, or so engaging the core like and all use right. So like that the client is improving. So already he learned the basic. Now he is improving his form, techniques and all. They begin to feel the movement better. So here the second stage, they feel the movement are getting better. That is associative stage. So in the trainer role, give more specific feedback. Keep your knees behind. So here, your client is already learned the basic, right? So he is improving. So now the feedback should be specific. So like keep your knees behind your toes, engage your core, uh, keep your back flat. So like these things, some specific feedback, not general feedback. Correct mistakes without overloading them to too much information. Help them refine technique. So you are helping them to refine the technique or improve those techniques. Okay. Now the final stage of motor learning, autonomous stage. What is autonomous stage? The client can perform the skill easily and naturally. Now the client is independent. So he can perform the skill easily and naturally. So like I said, now he don't have to. He's not constantly focusing and thinking that okay, I have to do like this. I have to activate these muscle groups. My hand should go like this. No, so this is the autonomous stage. So he already learned the skill. Now the movement is very smooth and automatic. So that is autonomous stage. What happens here? The movement is automatic. Though they don't have to think much. They don't have to think that while doing squats, my knees should not go too forward, or I shouldn't lean much forward. I should keep my back flat and all. They don't have to think too much because they all already learned the things by practice. Now they can just focus on intensity, speed, performance, not the basic skill. So they already learned the basic skill. Now their goal is to increase the intensity, increase the performance. In overall, their goal is to take their fitness to the next level, not focusing on the basic things. So that is autonomous stage. Okay. So in autonomous stage, they already learned the basic things. Now the movement is smoother. This is movement is automatic. They don't have to think much about those movements. They don't have to constantly think about those movements. So they should focus only on the intensity. Means increasing the weight or increasing the speed. So or performance, not the basic skill. So that's the autonomous stage. So what is your role in autonomous stage? Less teaching, more observing. So they already learned the basic, right? So you shouldn't teach more. So now your goal is to more observing. Introduce new variations, so progression. So you should think that how should I make the exercises difficult? How should I increase the intensity? So like that. Introduce new variations, progressions or advanced drills. Start the cycle again with new skills. So the autonomous stage is the final phase of motor learning. Here the client has practiced the skill so many times. that it becomes automatic. So in the beginning, if you're driving a car means you should be very conscious, but after a few weeks or after a few months, it becomes very easy. It becomes automatic, right? You don't have to constantly thinking, how should I turn? How should I change the gear? When should I apply brakes and all? It becomes automatic. They can perform it smoothly, confidently, and without thinking too much. What happens in this stage? The moment it feels very easy and natural, the client no longer focuses on how to do the skill, it just happens. Okay. Important, right? The client no longer focuses on how to do the skill, it just happens. So that is autonomous stage. Okay. In simple terms, what is cognitive stage? Learning the basics. Associative stage, already learned the basic, now practicing and improving. What is autonomous stage? The skills becomes automatic. So already the client is mastered those basic skills. That is autonomous stage. Now the in autonomous stage, the trainer introduced new challenges. Okay. Now is learning styles. They gave three things. One is visual learners, auditory learners, kinesthetic learners. I think not very important from exam perspective. Let's just see what is these three things. Very simple. Visual learners. Visual learners understand best by watching. So you'll learn by visual things. So you watch and you'll learn. That's it. Best teaching method, show them the movement clearly and allow them to observe before trying. So you should demonstrate and show them because they are the visual learners, right? Now don't ask me that how will we know that who is visual learner, who is auditory learner, or who is kinesthetic learners and all. I don't know. So you should figure it. Okay. Prefer reading or seeing demonstrations. They prefer reading or seeing demonstrations. Say things like, oh, I see, or let me see that again. So, in general, they see the things and they learn. That is visual learners. So, okay. So, the teaching method is just demonstrate the exercises, demonstrate the movements, they will learn. Next is auditory learners. Auditory learners learn best by listening. So here you should explain them. So they will learn the things by listening. So prefer explanations and verbal cues. They prefer explanations and verbal means verbal explanations. Verbal cues means some reminders, signaling and all right. Verbally you are providing. So that is auditory learners. Best teaching method. Explain the steps in detail and use a question answer style. So auditory learners, you should explain the steps in detail. Verbally, using words, using sentences, you should explain them for auditory learners. The third one is kinesthetic learners. Kinesthetic learners learn best by doing and feeling. Say, by experiencing, they learn the things, not just seeing or not just listening. They will perform the exercises, they will experience that, and they will learn. That is kinesthetic learners. They usually want to try the movement themselves. So they don't want to just observing or they don't want to just listen. They want to try the movements. They want to try the movements themselves. That is kinesthetic learners. Prefer hands-on guidance or spotting. So you should help them to spot by giving some support and all because they will learn like that only, right? So that's what they're saying. Say things like, I feel that, or this doesn't feel right. Best teaching method, hands-on supervision. Hands-on supervision means giving some support and all, and letting them practice as soon as possible. So you shouldn't keep explaining them or keep demonstrating them. So you should directly get them into the bench and make them to perform the movements. So that's what they're saying. Tell, show, do is the best teaching method. Tell, show, do. I think now already you know what is tell, what is show, and what is do. Tell. Give a short, clear explanation of what the movement is and why it matters. So tell means always before starting the exercises, you should explain your client, right? So see, you can't take your client, come sir, here stand. Okay, now I'll show you and you should do that. Not like that. You should give some explanations. What I'm going to do now. Why these exercises is important. So you should give some explanation for them. If even if your client is completely a beginner, not just taking them to and all, see, do this exercise, I will show you, you also do, not like that. Okay, so give a short clear explanation of what the movement is and why it matters. Keep instructions simple and safe. So you should also keep the instructions very simple. You shouldn't complicate the things. You shouldn't bring physiology, biomechanics and all. You shouldn't confuse your clients, right? So you should keep it simple. Next is show. Okay, the first is you will explain your client. So what are we going to do and why this is important and all. So you give some explanations to your client. Next, show, demonstrate the movement. You should perform that movement. Clients learn better when they see it done correctly. If your client is beginner and if you simply say that see, squat means you have to take your legs, your hip width, and you have to push your hips back and you should go down, you should keep your back flat. So if you tell them, then they'll not learn, right? So you should also show them. So first you should give some explanation what we are going to do, why it is why it matters. The next, you are going to demonstrate that movement. When you demonstrate that movement, clients will learn better. Oh, okay, this is a movement, I should do like this and all. Clients learn better when they see it done correctly. Focus on the goal of the movement, not too many technical details. So you shouldn't go too many technical details and all. The next is do. Let the client perform the movement. Okay. So in the first tell, you explain the things. In the second show, you demonstrate it. Now the third do means you should allow your client. Let your client do the movement now. So that is do. Let the client perform the movement. The trainer watches, gives feedback, and keeps the client focused on the task. So that is do. Tell, show, do. Just understand what is tell, show, do. In exam, they may ask one question about this and all. So, yeah. Now, the final thing is providing feedback. So, you all know what is feedback. Now, let's see intrinsic feedback from the client's own body. This is the information the client gathers through their own senses. What they feel, what they see, what they hear. So the feedback comes from their own senses. For example, they gave an example. Oh, that rep felt smoother and smoother than before. For example, if you are going to the gym and if you are doing squats, means you'll get that feedback, right? Oh, okay. This time I did 10 repetitions very easily. Before in the last week and all, I was struggled to do 10 repetitions. So I did 10 repetitions very easily. So I think next I should try 12 repetitions, or next time I should increase the weight. I'm doing it very easily. So you're feeling that, right? So that is intrinsic feedback, not someone else is giving to you. You understand, right? This is the information the client gathers from their own senses. So you will only get this feedback by what you feel, what you see, and what you hear. So also, see, feedback means it can be positive and it can be negative also, right? So you may feel that, oh, I used to do 10 repetitions very easily, but today I am struggling to do 10 repetitions. My energy levels are going down. So that is a negative feedback. If you think negative, intrinsic feedback. If you think the movement is going very smooth, now I am doing 10 repetitions very easily, I can increase the repetition or I can increase the load, means that is intrinsic positive feedback. So feedback can be negative or positive also. But mostly in ACE, we are focusing only on the positive feedback. Okay. So intrinsic feedback means information the client gathers from their own senses. Okay, that is intrinsic feedback. Next is extrinsic feedback given by the trainer. So this is reinforcement, correction, and encouragement provided by the trainer. One example, good job keeping your knees in line. So when you're training, you're supposed to give only positive feedback, not negative feedback. You should always give them positive feedback. Okay. Good job keeping your knees in line. uh, Lift your chest a little more. For example, if your client is doing squats and if he's leaning too forward, means you shouldn't give feedback like so you're leaning too forward. That is wrong. Not like that. You should give feedback like lift your chest little more because that is little positive, right? If you tell your clients that no, your back is not okay, you're leaning forward, means your client may get demotivated. Instead, you can say that you did well, but lift your chest little more higher. That will be more better. So you can give feedback like that. You're improving, keep going. So that is these are all extrinsic feedback. So hope you understand the differences between intrinsic feedback and extrinsic feedback. Okay. So you can give only extrinsic feedback. As a trainer, you can give only extrinsic feedback. So intrinsic feedback is their clients their own, right? So extrinsic feedback is important, especially for beginners. So if you're a client is beginner means for everyone, extrinsic feedback is important, especially for beginners. But too much feedback can make the clients dependent on the trainer. Okay. As confidence and skill increase, the trainer should slowly reduce the amount of external feedback. So in the beginning stage, what is external feedback is very important. But once your client is mastering the movements, means you should reduce extrinsic feedback. So the clients learns to rely more on their intrinsic feedback. Okay. So, and it will be very overwhelming, right? For example, if your client is already learned the basic things, so he's not completely a beginner, and if you're still keeping extrinsic feedback like, okay, no, your back is little more, you should keep your back little more high, your knees should a little more. So if you keep giving too much feedback, also your client get overwhelmed or it may decrease his motivations also, right? So as confidence and skill increases, so if your client's confidence and skill increases, trainer should slowly reduce the amount of external feedback. Okay, so the client learns to rely more on their own intrinsic feedback. Guidelines is for giving good feedback. For example, yeah, see, when you're giving feedback, you should know to give the right feedback. Okay. Keep it simple. Don't overload with the too many cues. Prioritize safe. Use positive phrasing. So you should always give in a positive way. The feedback should be always in a positive way. So say remember to breathe instead of don't hold your breath. So if your client is doing some exercises and if he is holding the breath, he's not breathing means you can't say that. See, you're not you're holding the breath. You shouldn't do that. You shouldn't give such feedback. Instead, you should give remember to breathe. Okay. Don't hold your breath is a negative phrasing. Instead, you can say remember to breathe. Okay. So, for example, if your client did 10 repetitions, uh, you shouldn't say that your last few repetitions very bad. So, your last four repetitions were bad. So, you should not give such feedback. Instead, you can say that your first six repetitions were excellent. Your client will only understand that okay, the next four is not great. So your client will only understand. So if your client is doing 10 repetitions, first six repetitions was good and the next four was bad, means you shouldn't highlight those four bad repetition. Instead, you should highlight those six repetition. You can say your first six repetitions were really good. Okay. So like that, that is positive phrasing. Feedback should be clear, brief, and helpful. So that is guidelines for giving feedback. Okay, we are done with the fourth chapter. So we'll have a practice test tomorrow. In the meantime, go to your textbook. So read the textbook in case if you think if you want me to cover anything else from the textbook. For example, I have skipped those few tables and all because, however, we are also covering those things here. Instead, if you want me to cover those things also means you can always message in the group. We can do one more lecture on this topic, not a problem. So in the meantime, go to your textbook, read the things, or you can also ask me if you want me to explain anything again. Not a problem at all. Okay. So fourth chapter is over. Next, in the next class, we'll see the fifth chapter. Maybe fifth chapter, or maybe we'll jump into the 13th muscular training chapter. Uh, I'm just thinking of going. What do you want? Do you want to go order wise or some mix of? Because in case if you're getting bored means we can check muscular training things and all.
I think we need not follow the order.
You like to go order wise? That's fine,
No,
not a
no,
problem.
not otherwise. We can swap the topics.
Yeah, yeah. So I was thinking like that only. So not just going the order wise. However, at the end of the day, we need to cover the things, right? So I'll try to make it interesting. However, you guys are all interested in this anatomy, physiology things, right? Exercise. So maybe we'll jump into that chapter. Let's see.
I have a question.
Yeah, yeah, sure.
In ACE, is there any separate topic how to prevent injuries?
No,
No.
no. In ACE, they don't have such things. In ACE, they don't cover nutrition also, very basic nutrition. In case if you're already did some basic nutrition certification courses means definitely in the ACE, you're not going to learn anything new here. Not anything related to rehabilitation things or preventing injuries. Not much about nutrition related things, not much about biomechanics related things. Yeah. Here, but we are going to see a little detail hypertension, diabetes, cardiovascular disease. That are all there. But not preventing injuries and all. Preventing injuries means see, it is going to be a big topic, okay? Because if you want to prevent the injuries, means you should first you need to understand biomechanics. You should learn to visualize the forces, and you should have a clear idea about kinesiology. What are all the joint movements? What are all what is the exact movements of those joints? So, of course, we are going to see these joints related joint movements and all, but not in depth, right? So, yeah. Any other question? Exam tomorrow. Yes, Soham. Let's have a practice test tomorrow. I am okay with everything, whatever everyone decides. Yes. Yeah, I'll check it.
On average, how long a person takes to reach a autonomous stage? How
Uh,
how many
can
months?
you come again?
Like how many months? How many sessions? In on average, a person can reach, or a client can reach an autonomous stage.
Autonomous stage, okay. See, it depends on individual, right? So, if your client is a 25-year-old guy, means he will learn very easily. He'll reach to that stage very easily. If your client is 40-year-old, means he may take a lot of time. And even if your client is just a 10-year-old boy, means again he will take a lot of time because for children also motor learning is very difficult. For adults also, motor learning is difficult. Uh, yeah, it depends on their what age also matters and their previous experiences matters. So depends on multiple things.
Can I say it is 1 year or 2 years on average? 1 year, 2 year, 4 sessions a week.
For everyone, 1 year, 2 years is not necessary, right? For example, some people reach to those autonomous stage within 2, 3 months also. But I have seen people are still struggling even after doing gym for 2 years also. So personally, I don't have any specific answer for this. So I believe how dedicated they are, how 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 dedicated they are. So what their past, their current, their present physical fitness depends on multiple things. But you don't have to see from ACE, you don't have to worry about those things, and also you should just understand the concepts, right? When you're training the gym, you can't bring these topics. Okay, you're in the cognitive stage, you're in the associative stage. Okay, now you reached the autonomous stage. You can't bring this theory into in practically you can't bring these theories, right? It's all for your understanding. This theory is all for your understanding. For example, you can't correct a client if in the first day itself. If you're asking him to do biceps curls, he's also lifting his elbows. You can't correct him in the one day because see, because his brain or nervous system needs to learn those movements. He needs some practice because that movement is new to him. So your nervous system is confused. So which muscles I should activate, which muscles I should neutralize. Nervous system doesn't know. Nervous system what will do is it will try to activate all the muscles. So triceps, biceps, triceps, everything. Because of that co-contraction, the client will do lift their elbows while doing biceps and all. So instead, you should give them some time and slowly they will learn the movements. So, yeah, it depends on their interest, their age, their past experiences, their dedication, how dedicated they are. Depends on multiple things. So, that's why you should know, right? So, why they are doing these mistakes. For example, before I think you didn't know why beginners always struggle to do these movements and all. But now you learned new things, motor learning and all. So what you know now, you know what is motor learning. So yeah, it is for your knowledge purposes. You don't have to worry about these things. So my client is in associative stage or autonomous stage. So in reality, you should always train your client from their current fitness level, right? So if your client is if your client can do only 10 kg, can lift only 10 kg dumbbells for chest press, okay? So doesn't matter what is his previous experiences, doesn't matter what is his age, that doesn't matter. The only thing you should focus is right now he is lifting 10 kg dumbbells. He is doing 10 repetitions. Now you should challenge him by asking him to do 12 repetitions, or you can challenge him by asking him to lift 12.5 kg dumbbells. Okay. So in when you're training a new client, so it doesn't matter how many experience he is having. So all you need to do is you should give exercises to challenge their current fitness level. Okay. You can't simply say that if your client is a beginner, you can't simply say that, oh, you're a beginner, you should always lift to 2.5 kg dumbbells only. So, because if he is very comfortable with the lifting 5 kg or 7.5 kg, means you can directly start from there. So, these are all the theories you should know, but you can't always bring these theories into the gym. That's the point. Any other question? Hi Karthik, please start with anatomy and physiology. Yeah, that's what I'm thinking. From past 1 month, so much of theory, behavior things. Yeah, these two chapters are quite boring. But the problem is, from exam perspective, it is very important. They will ask a lot of questions from these chapters. Okay. Yeah. So the problem is, all these terms are new to us. In daily life, we don't use this active listening, motor learning, or motivational interviewing, cognitive learning, associative learning. We don't use these terms in real life. So yeah, but exam perspective, it is very important. So maybe the next class we'll do some anatomy, some muscle physiology. Let's see, maybe 13th chapter, I guess. So we'll muscular training. So we'll get into that chapter. Okay, then no questions, right? Any last minute question? Chiru, Nirish, Raj, Soham? No, no. Okay, then. So let's meet day after tomorrow. So today is Wednesday, right? Yeah. Next is Friday. So I'll let you know. I'll tell you the chapter, which chapter we are going to cover. So bye all.